All right. Well, welcome here to this session, a conversation with Congressional Democrats. There are, of course, 435 members that get to vote in the House of Representatives, but we have two of the smartest and most impactful in terms of health policy in the country, and so we're super honored to have them with us. Congresswoman Dr. Kim Schreier, thanks for making time from Washington's 8th Congressional. Appreciate you being here. And Congressman Earl Blumenauer, who is a sage among sages in the House and knows how to make health policy work and function. Congressman, thank you for being here as well. Appreciate you both. Congressman, let me ask you first to start. What do you we're sitting here in April 2021. You and I spent a little time with Governor Kitzhaber back in, I think, October of last year. Today, what are you spending your mental energy on when it comes to healthcare and health policy? Can you hear me, Congressman? Can you hear me now, Congressman? Congresswoman Schreier, you can hear me, can't you?
I can hear you, yeah.
Yeah.
Can you hear us, Earl?
Yeah.
Oh, okay. Can you hear it? DJ, do you want to repeat the question for Representative?
Oh, I thought that was directed to you, Kim. I'm sorry.
So, Congressman, can you hear me okay?
I can, yes.
Okay, great. So, this in this world of tech, it's like it's always something. So, what are you spending your mental energy on these days?
Well, we live on these Zoom calls, but it actually gives us an opportunity to really expand the sweep, talk to more people, process information, and candidly, the election results in Georgia transformed this session of Congress. It was already going to be one of the most impactful in American history. With the Democrats in control of the Senate, I think it will be the most impactful. You've already seen the $1.9 trillion in the rescue plan, and we're hard at work in the Ways and Means Committee seeking to build upon that. Things that I've worked on for a number of years dealing with issues of kidney health, end-of-life care, value-based medicine. These things continue, but right now our focus is trying to take the very real positive developments that were passed in the rescue plan and making them permanent. The reduction that we've seen in terms of premium costs, the opportunities for individuals, whether it's COBRA going forward, we've got a chance here to build on that, limiting what people will have to pay in terms of premium costs. People who have unemployment this last year don't have to pay any premium. We want to build on those elements to make sure that they are made permanent with a larger package going forward, perhaps reconciliation. Already, you've seen legislation with the expansion of the child tax credit, the largest reduction in child poverty in decades, perhaps reducing it by almost 50%. We're hard at work to try and make sure that we're building on that and working with the administration so that these are not just temporary additions, but we can deal with some systematic change.
Congresswoman Schreier, let me ask you the same question, just simply about what you're spending your mental energy on and your attention on when it comes to health policy these days.
Well, of course. First of all, I agree with Earl that a lot of our attention has really been on the rescue plan, but included in that are a lot of our priorities regarding healthcare, access to healthcare, cost of healthcare that have been priorities for a long time, but were made acutely necessary by the pandemic and how it's affected certain communities. And so a real attention on child poverty, on healthcare access, on bringing down premiums in the context of COVID has been critical. We're also thinking about infrastructure, but I want to talk about in healthcare specifically, talking about exactly what we demonstrated in the rescue plan with how to make healthcare more affordable, more accessible to more people. But I'm also thinking about the healthcare itself. Right now, my particular passion is on rapid at-home testing for coronavirus. And I've been on this for months. I mean, really, this dates back to last summer when, I was asking questions and was told in meetings, we're going to have it soon, we're going to have it soon. And let me just explain for people listening today what this means. If you had a $1 or $2 test that you could do at home every day to see if you have coronavirus, and if everybody kind of did that the way we brush our teeth in the morning, you could find out if you're one of those asymptomatic carriers who can spread it to others. Stay home. And that would help us end the pandemic, certainly slow it really quickly. So before we had a vaccine, it was our best chance. Now, I still think we're going to need this kind of rapid testing because children aren't going to be immunized for quite some time. Not everybody's getting vaccinated, unfortunately. And so it is an incredibly important tool that I am really pushing and working with the FDA on getting approved. And then the other is just, overall healthcare in this country costs too much. And we need to figure out why we're so sick as a nation. And when we address that, then fundamentally healthcare costs will come down because we won't be so expensive to take care of.
So I want to kind of get in the weeds a little bit here. Congresswoman, you're on the House Energy and Commerce Committee. It's a centrally important committee on healthcare. Congressman Blumenauer, you're on Ways and Means also. But first, since we have folks from London to Hawaii and of course throughout the continental United States, Congressman Blumenauer, let's start with you. Tell us about your Portland area district and the kind of community that you represent.
Well, it is one of the most livable communities in the United States. It is, in terms of transportation, housing, land use, we've been on the cutting edge in terms of innovation. And I would say in terms of healthcare, our community has been receptive to innovations. We have a large Oregon Health Science University. We have a significant penetration of Medicare Advantage because during World War II and the shipyards, Kaiser pioneered that effort and it transitioned in terms of managed care. We are an area that people look at innovation and change. We've had some rough times of late in terms of, no secret, in terms of the aftermath of the George Floyd and the Black Lives Matter cries for racial justice. There were challenges here, but I think people are responding in positive ways on a wide variety of things that will make a difference in this pandemic. I've been working, for example, in terms of the food. This is a community that's focused on food and restaurants, nutrition, opportunities for getting back to basics in this area as well. Also, in terms of alternative transportation, bikes, light rail, streetcar, and integrating it into land use. We've pioneered some innovations, and I'm hopeful that we're going to be able to do that going forward. This is the most consequential period, I think, that we've ever seen in terms of the stresses on the political process, the economy, the healthcare system, the disparities that we've seen. And here in Portland and in Oregon, I think we're making a good faith effort to try and get our arms around that.
Congresswoman, how about you? Tell us about your more suburban but Seattle area district up in Washington State.
Yeah, my district's really interesting. I describe it as a mini Washington State, and when you think of it that way, it's almost like a miniature United States of America. So I have suburbs of Seattle with Amazon, Microsoft, Starbucks employees, highly educated, many H2A, H1B immigrants who are working in high tech. My district also extends south, includes Mount Rainier, rural Pierce County, So we have a lot of rural America there, and it crosses over the Cascade Mountains into the apple capital of the world, where agriculture is king. We export, we have something like 300 specialty crops in the state, but our big exports are apples, cherries, pears, hay, wheat, potatoes. And so I get to really represent a big slice of rural America and their concerns as well. So it's a great way to speak to large swaths of the state and to get a sense of where the country is.
So Congresswoman is one of Congress's only medical doctors. How you're now in your second term? How have you found the conversation, particularly amongst your fellow Democrats who want to do something on healthcare, but may not have the real world experience that you have as a physician? I'm sure even though you're relatively early in your career, I think you probably have an outsized amount of authority on this because of your medical training. Give us a sense of what it's like talking about health policy and wrestling with it with other members in your Democratic conference.
Well, first, it's just a real pleasure to be in Congress and to bring this voice. A woman doctor and the first pediatrician. I bring unique perspectives to everything from, what we just talked about with child poverty to healthcare itself. And I think that having the MD does bring an element of authority on the issues. But I think what it brings to my thinking about healthcare and healthcare policy is just a great deal of nuance. That we have a very complicated healthcare system that is in a crazy balance. I mean, if anybody were designing a healthcare system, we would never design it from the ground up the way it is right now. And any tweak that we make to our healthcare system is going to have ripple effects down the line. And so being able to step back and just appreciate, if we do X, here is a possible unintended consequence, Y. And so having that ability to bring real world experience and think about healthcare in nuance is really, really helpful.
Congressman, I wonder what you think about, rather, let me ask this question this way. The Democratic Conference has a lot of folks who argue that the ACA should be built upon, like Speaker Pelosi. There are a number of folks in the conference who think that we should get rid of the ACA and do something more, in their words, progressive or maybe revolutionary. You have a progressive district. The American Rescue Plan seems to me to really build on the ACA to expand some of the benefits there. Has that debate within the caucus sort of been set aside because we see so much effort around building on the ACA in the American Rescue Plan, or is that still an active conversation about which direction to go with health policy? You're on mute, sir.
It's me. I think it's still an active conversation about which direction to go, but as a practical matter, we're moving down that path now. You remember we couldn't pass a public option when Democrats had overwhelming majorities when we were dealing with the Affordable Care Act. We have narrow margins. We have massive challenges. I think it's important for us to build on what we have done, but that is not to say that we cannot make, I think, some very revolutionary changes. I think this administration is poised to be able to make big changes in terms of the outmoded fee-for-service model. They are putting resources in a variety of areas. I think using the administrative tools that they have with 1115 waivers, 1132, being able to move towards some global budgeting. Oregon, you may have noticed, had 40 healthcare providers that signed on to an alternative-based model. It's kind of an outgrowth of some of the sustainable health I'm blanking what we did in Eastern Oregon with the CCOs, where we were able to actually restrain costs and give people opportunities to share in the upside and the downside. We have to be able to move forward, not just expanding coverage, because we're setting ourselves up in a year or two when the short-term subsidies evaporate, that there are increased costs as a result of expanded coverage. Money goes away, and we're going to not be able to invest in the social determinants of health that we know that make such a difference. I am hopeful that we can work with this administration and others in this space to be able to do something that is modeled on what we did in Oregon on a more limited basis, that showed that the advanced funding we got from the federal government paid for itself and surplused over $1 billion based on that investment. I would like us to be able to be a little bolder, work with the administration to try and build on things that are successful. I'm not a physician, but I've worked on healthcare for 25 years in Congress. And I've been frustrated that I think we make these things more complex than they need to be. I spent 10 years trying to get the federal government to put a value on an end-of-life conversation with patients and their families. I think we ought to be able to use some of the tools we have now, the urgency with the COVID crisis, the potential of using reconciliation and building on the rescue plan. I think we can cut through some of this. And I think there is an urgency the doctor is talking about nuance, and I agree with Kim, but I think sometimes we end up being paralyzed because of the complexity, and we cannot continue to spend about twice as much as every other wealthy country in the world for what for too many people is mediocre care. We've got models that work. I think we ought to integrate them into what we're doing with this administration and use the urgency of this hour and some of the tools we've got.
Congresswoman, how about your thoughts on another divide I think that sometimes comes up within the Democratic caucus, which is that state-based flexibility has its place, but that if you allow progressive states to move forward, you leave behind other folks in other states, and that maybe a national solution is better policy in healthcare reform. Do you have a sense of how that debate and balance may tip towards greater flexibility for states via waivers or expanded waiver authority versus doing something at a national level to make sure no states are left behind?
You know, I think that what you do is you merge those two. Like, I was really enjoying listening to Earl when he said, I'd love to learn more about what Oregon did, but the ACA built in that ability for states to take their money and use it in a creative way to see if they could increase access, bring down cost, improve care, have better outcomes. And I think that's a great idea. I mean, we've got 50 states. Let's have 50 different incubators of good ideas. But you need guardrails on that, because what we have seen in other states is that they would like to have these skeleton plans, kind of scam plans, make them cheap, but then they don't really cover what you need, and you could be left, really in a very precarious situation if, say, you have a skeleton plan that doesn't cover pregnancy, and you become pregnant, or you name it. And so I think with the appropriate guardrails, giving states the ability to say, hey, we're going to reimagine healthcare and we're going to try this out. And if it is wildly successful, then let's roll it out to some other states. I think that's just smart policy. And the federal government can learn from state incubators.
So, Congressman, we cover 15 states here at State of Reform, and I think the Oregon model is extraordinary in a lot of different ways. I think the world of Governor Kitzhaber and his leadership. I think a lot of states would do well to adopt Oregon's approach and a capitated model like you had suggested, but those states haven't. And when I hear those states talk about it, they say, well, Oregon's different and we're not Oregon. So I want to ask the same kind of question to you that I asked the Congresswoman, which is this balance between increased waiver authority versus forcing everybody in a national policy to move forward. Do you think that, forcing some states to implement a global capitation like Oregon has done is really the only way forward on that?
No, I don't. And I think what Kim said in terms of being able to blend these things, but her point about guardrail are very, very important. For example, I've supported Medicare Advantage. It's something that's very important to my community, and done right, it's an opportunity to unlock value and provide better service. But it doesn't work, for example, if we don't maintain the standards that we put in there. And we've been too lax in so much of the healthcare system, whether it's how we evaluate Medicare Advantage. We ought to be more rigorous about that. Some people, frankly, if they don't deliver, should not be rewarded. What's happened in terms of nursing homes, where we've not been aggressive about maintaining and enforcing the standards that were established. I agree that there's opportunity to learn from the states. I think that we ought to provide incentives for the states moving forward. I think it's a pretty powerful example, as they're going to be looking at greater cost problems, because some of these things are going to expire. Costs continue to go up. We're looking at a pretty significant federal deficit. And I think we're on the right path now. I think we made the right investments. I think in the long run, they will pay off. But at some point, we're going to be constrained in terms of costs. At some point, there's going to be much more interest in being able to have cost recovery and revenues. And I think we ought to be positioned to be able to do that. We don't have to have one national plan that everybody follows, but we need to have the standards that are established when they get federal resources on programs that are national in scope. People need to perform. I don't see any contradiction in that. I think the federal government has been too lax, and it has had negative consequences for the health of the country.
Interesting. Congressman Blumenauer, let me ask you this additional question, which I draw upon my conversation with Congressman Dr. Michael Burgess, who's a senior member of the Energy and Commerce Committee. He's a Republican and helped draft the Republicans repeal and partially replace legislation from 2017. And in asking him about the lessons from that experience in 2017, he said that the Republican conference was trying to write legislation for the budget reconciliation process, and that his advice would have been to pass what the House wanted and then let the Senate figure out how to do its job. You're kind of in a similar position now, where you have to at least be mindful, particularly on the Ways and Means Committee, mindful of the Senate reconciliation process. Do you think that the House should draft legislation that can make it through the reconciliation process in the Senate, or should the House just do what the House wants to do and let the Senate figure it out on its own?
I think we ignore the realities of the reconciliation process in the Senate at our peril. I think we have more latitude, and in fact, the Senate, in my experience, always does what the Senate wants to do, but we can help shape and direct and provide some momentum. We don't want to make it harder for them. I am of the opinion, however, that what we are doing in the Ways and Means Committee now in the infrastructure, what we're going to be doing in the next package, provides opportunities for the Senate to build on that and be able to work with this administration to be able to deliver. I think there is an extraordinarily talented group of people that are in the healthcare space with the new administration. I think a number of these people have had great experience trying to navigate the Affordable Care Act. They looked at what worked and what didn't, disappointments, frankly, in some cases where we fell short, and having too limited a vision, we end up tying ourselves in knots. I mean, why shouldn't we be able to use the benefits of research to inform our healthcare policies? that's a concession that I think I didn't agree with it at the time. I was involved with the death panel controversy over the aforementioned end-of-life care. I think we are learning that some of the concessions that have been made did not have long-term benefits. And I think there is a growing awareness on the part of the American public for these types of reforms. And I think what we have just finished doing is going to build on that. People are going to see the benefits of the broader picture and the benefits of the leadership of the Biden administration.
Congresswoman Michael Huntington has a question. He says, both speakers proposed reducing complexity and cost, but have not yet openly talked about House Resolution 1976, the 2021 Medicare for All Act, which he calls the ultimate solution, publicly funded and governed universal health care. He wants to know what your thoughts are on that bill, but maybe in general, I'm interested in Medicare for All, what your thoughts are there, and whether maybe expanding the age eligibility down to 55 or into 50 or other levels, if that would make some sense in your view.
Well, I'll jump in. I think that the public trusts Democrats because we know that our goal is to get more people covered in an affordable way, and to improve the health of our communities. And there's many ways to do that. It took probably 10 years for people to realize how much they treasured the Affordable Care Act, because when it was, the threat was there to take it away, people were up in arms. And I think that this is a project to build on. I also believe that had the Democrats had their way with the Affordable Care Act the first time around, we would have had a public option, which is something that would improve on it. And we also would have allowed Medicare to negotiate the cost of prescription drugs. And those were provisions, it's my understanding, and Earl, you were there at the time, I was not. It's my understanding that those got taken out in an effort for bipartisanship, and ultimately resulted in really high costs and giveaways to big pharma, and not having a public option to compete with private insurance. And so having those two elements added back in to make the Affordable Care Act better, I believe would bring down costs and make healthcare affordable without overhauling our total system. I'll add one more thing, which is just that, my district is a very purple district. I mean, I'm one of the few toss-up districts in the country. Like I said, it really reflects the United States of America. And so here's what I hear from my constituents. Constituents who get their insurance from work in my district are pretty happy with what they have. And they're nervous about giving that up for something that is uncertain right now. Like it's once you have something, it's very hard to take it away and to feel secure about that. And so mostly what I hear is that if I have insurance through my job and that's part of my compensation package, and you're telling me that will go away, and now I would not only not get that benefit, I would have to pay more in taxes, fees, whatever you call it, to fund a Medicare for All type of program. That's kind of potentially a lose-lose scenario for them. And so I think that walking this line of what can we do with the Affordable Care Act to make it better, more affordable, more accessible, is the direction to go. And I also think, again, we need to focus on why we're such a sick country. Healthcare is too expensive, whether it's the government paying for it or private insurance. It's just too expensive here.
Sorry to have jumped in over you there, Congresswoman. Congressman Blumenauer, do you have thoughts on this question about Medicare for All or expanding the age eligibility for Medicare?
I do support the legislation. I've co-sponsored it. But what Kim said about being realistic about building on increments that we can deliver on. I mean, we couldn't get even a public option passed when we had larger majorities in the Obama administration. We were dealing with the ACA. We're building on some success, but I think I'm keenly interested in any element that moves us forward. I would be interested in, you mentioned potentially lowering the age for Medicare. We've got a range of things that, in terms of, you mentioned prescription drugs, food. I mean, we subsidize a diet that makes Americans sick. Having an opportunity to link nutrition with health and giving things that people can get their arms around and feel good with. Explore what is possible with the public option. I think what we have in the pipeline now, in terms of building on very significant things that we got in the rescue plan, in terms of, as I mentioned earlier, the fact that anybody who's on unemployment this year doesn't pay a premium, that we can deal with the medical loss ratio, that we're going to make sure that the subsidies that we've expanded, that we make them permanent. And of course, the child poverty cut in half with the earned income tax credit is a very significant healthcare item in and of itself. I want to build on these elements, show the American public results as we move forward. Ultimately, I think we will have universal coverage. I support that. I think it's important. And I think ultimately that is a cost savings to individuals and to the taxpayers. But we're not quite there yet in terms of being able to have the majority of the public believe us and being able to do the things that get us to that point. That's why I keep coming back to things that we've done in Oregon to bend the cost curve, what we're doing in terms of building on things in the Recovery Act, and areas of reform where the public can help us with things that are that may appear to be bite-sized but have outsized influence, things like kidney health and end-of-life care.
Congressman, I want to follow up on a question or comment you made earlier. This comes from Brian Bills. He asks about, in addition to funding for health insurance and for healthcare services, do you see the possibility of funding for quality improvement in healthcare, example, for training or quality improvement for healthcare providers? Some of that, I think, happens within the Oregon model that has been referenced, but in terms of new legislation to fund quality directly, what are your thoughts, particularly as a physician, on how that might happen?
Well, here's where nuance comes into play. I mean, I agree, right? Of course you want quality. So the devil's kind of in the details here. For example, let's say, I'm just going to throw this out. I have type 1 diabetes, so I'm going to throw out this one example. If you decide you're going to reward doctors who get their patients' hemoglobin A1Cs below a certain number average, that sounds like a great idea. You'll bring people's blood sugars down, we'll have healthier outcomes, fewer people will end up with chronic kidney disease, retinopathy, all the things that cost a ton down the line if you can do this. However, that sounds great if you are a doctor in a fairly wealthy suburb where you have really compliant patients and you have access to great food and they can afford their medication and they have a safe place to go outside and exercise. There's a whole different calculation if you are working in an impoverished area where food choices may be dictated by what's at the local food bank, where there's a ton of stress, maybe not a place where you can exercise. And so to penalize those doctors for things that are really not in their control, I think is tough. So, having best practices, having clear guidelines on when you need antibiotics, when you don't, having guidelines on when you really need an X-ray, when you don't, I think those are some of the things that we can address. We all want better outcomes. And I'm actually really intrigued by a direct primary care model that has been shown to have lower costs and better outcomes when primary care doctors are available to their patients. They have a panel of fewer patients, but get to spend more time with them. And that upfront time can result in better habits, working more as a team, having better outcomes with lower costs. So this is where, again, let's see what the states do. Let's let them incubate great ideas and let's get better value.
Congressman Blumenauer,
I agree with Kim. I have legislation that made it easier to provide direct primary care because we've had a quirk in the tax law that's made it difficult. But that's another area of things that we can do now that'll make a difference. Things that we can do in terms of, we spent billions of dollars subsidizing farmers because of the damage of the Trump tariffs. Instead of spending billions of dollars subsidizing healthy food to deal with the food deserts. I think having an opportunity in this time of COVID crisis, when we're moving huge sums of money, and when the administration has announced very bold plans for healthcare, for infrastructure, for rebuilding government's ability to deliver, I'd like to cut through some of that. I after 25 years, I get very frustrated about lots of small steps. I think of things that we've done just nibbling around the edges and don't have much to show for it. This is a time when I hope that we're all thinking about swinging for the fences, for things that will actually be transformational. I think there's an opportunity for the public to understand what is at stake. And we have the potential for the first time in the 25 years I've been in Congress, where we have all of the forces aligned. We have an administration that is willing to do these things. We have an opportunity to get a path through a Senate that has been a challenge. We have still the House in Democratic control. And we have a public that understands the urgency of the hour. So I'm hopeful that we can put some of these pieces together and be able to show direct, tangible results for the public and build on the successes of things we've already passed.
Congressman, walk us through that last statement about why you think the time now in 2021 is more advantageous than the 2009-2010 period, where Democrats had 60 votes for most of that period in the Senate and a stronger House majority. Why is now more opportunity in your view?
Well, I think because we have the results of what happened as we temporized. Kim mentioned there was a lot of effort made, and I was in the middle of that in terms of some of these decisions where we pulled our punches, we pulled back, we didn't do things that the experts told us we should have done because it raised hackles on Republican colleagues. But we cut back on those things. What we got was an Affordable Care Act actually that was suboptimal. It was too complex, and it didn't buy us bipartisan support at the end of the day. In fact, we've seen Republicans since that time have been focused on repealing it, and not offering constructive alternatives. I think we realized that when we had the American Recovery Act in the Obama administration, that we ended up not doing enough, and we didn't do it long enough, and it cost us more, and it delayed the recovery. I think there are a number of us that I feel learned from some of those lessons, and I think there's a pretty strong record to support being a little bolder and more direct and not settling for suboptimal, because we have the coronavirus pandemic, we've got the massive economic problems, we've got the cries for racial justice. You look at all of these challenges that we are facing, and I just don't think in this moment we can afford to try that elusive path that hasn't worked in the 25 years I've been in Congress. I have always worked for bipartisan support. All the legislation, major initiatives I've done have been bipartisan. And I just think at this point, when we have such a gap between the two parties, I don't think this is the time to chase it. It's a time to try and provide some results. If Republicans want to get on board, that's great. But until they have proposals that get us there, I think we ought to go ahead and deliver for the American people.
Congresswoman Schreier, we have a question here that I've just lost from Ida. Where did that go? Ida Roman, who asked about, she says, while it's true that a number of Americans are sick and that sickness and utilization drives up costs in American healthcare, her argument is that it's really about some of the system level items rather than individual health that is driving cost. And she specifically mentions hospital charge masters and hospital pricing. And she asks about what policies are underway to address those. Do you have some thoughts on how you want to answer that question, but how you would approach regulating pricing or driving transparency of pricing in the system in general?
Well, it's a great question. Again, the reason that hospital pricing is crazy is because of our system, right? I mean, the retail price is not what your insurance company's paying, and you're only paying the retail price if you don't have insurance. So that's how screwy it is, right? I mean, I just picked up my insulin, for example. I'm just going to throw it out there. I have good insurance. I pay a lot to have really good insurance. And the paper from the pharmacy said your insurance saved you $2,251 on this prescription. And I thought, there are very few people who are paying that $2,251. Those are people either with really lousy insurance or people who are uninsured. So it's not even really, it's like in many cases, not even a real price. Same thing with the hospital. So hospitals are trying to make up for low Medicaid and Medicare reimbursement rates by charging a whole lot more to private insurance. And that is the crazy dance that our country is doing right now. So I will acknowledge that our pricing system is not transparent, and it is crazy, and we have a lot of interest. Right? We need to take care of people. We need to keep our hospitals in good repair. We've got to keep our hospitals afloat, especially rural hospitals that are always hanging on by a thread. And these are all of the things that we need to balance. If I could just add on to something that my colleague Earl was just saying, I think we have learned lessons about making sure that we deliver, and that we are very cognizant that a bipartisan bill is not necessarily what you accomplish in a bipartisan fashion in Congress, because Washington, D.C. is broken. I mean, it's like there's just a lot that is broken about the system. But if you look at a bill like the American Rescue Plan, and you look out there across the country, and you've got 70 to 75% of Americans saying, yeah, I like this. This is a good idea. This will help me. This will help my family. I want that. That's a bipartisan bill. When you've got, and so I think it's just really important for us as a Congress, as we are legislating, to look at the fact that, the results of the last election show that people want us to help in these various ways: the pandemic, healthcare, economic stability and security. And that if we don't deliver on that because we are waiting for bipartisan support in the Congress, when 70 to 75% of the American people are saying, yes, go for it, we got to listen to the public. That's our job, to listen to our constituents.
I know we're near time here, and I want to ask both of you just to sort of answer this question about what gives you hope in the political process for 2021. It's sometimes a place bereft of hope, but it sounds like there's a lot more hope right now that you have compared to other times. So, Congresswoman Schreier, let me ask you first. What are you hopeful about here out of the political Congress in 2021?
I'm really hopeful that we will be able to deliver. We've already delivered on the American Rescue Plan. That's a really big deal. Government is functioning. I want to show the public that when government works well, it is a force for good. And, it's not big or small, it's how effective we are. So if we can really bring down the cost of healthcare, get people covered, make people healthier, get these shots rolled out, get our economy back running again, and have our children in classrooms, those are wins. And, those are because of efforts of a Democratic caucus in the House and the Senate, working with a Democratic president to get it done and deliver. And I'm really proud of that. It makes me optimistic.
Great. Congressman Blumenauer, what gives you hope in 2021 about our political system and what can be done?
Well, I think what has happened, particularly at the beginning of this Congress, was a wake-up call. We see how fragile systems are. The cries for racial justice, the people who tried to overturn the election and the riot in the Capitol. But by the same token, a point Kim made, that actually what we are doing is bipartisan. It is supported by Republicans around the country, by a number of Republican elected officials who are county commissioners or mayors or governors. It's just not the congressional Republican cohort. I am pleased that there is a broader awareness for so much of what we want to do, whether it is gun safety, whether it is dealing with nutrition, it is focusing on results. The healthcare reforms are well known. The experts agree. It's not controversial or complex, except for the politics. And I think being able to move forward in this climate with building on what we've got, trying to make sure that we do focus on results and change the system a little bit so that people are rewarded. That's why I'm keenly interested in working with Governor Kitzhaber on global budgeting, not just in Oregon, but extend it to other states and ultimately throughout the federal government. We've seen results. We know that we can invest money more effectively. We know that we can't keep going the way we're going with some of the insanity that's taking place, whether it's prescription drug prices or scrambling to make it hard to do basic things that people want. I'm optimistic that we've had a convergence of public opinion and urgency, the politics, and our past experience. I think this is within our capacity. I think it can be transformational. I'm optimistic that we can put these pieces together.
Well, Congressman Earl Blumenauer, Democrat from Oregon and member of the House Ways and Means Committee, and Congresswoman Dr. Kim Schreier from the great state of Washington and member of the House Energy and Commerce Committee. To our attendees, you know why I said at the beginning these are two of my favorite members, super smart, very well informed, different and great experiences and perspectives. Thank you both for being with us. I appreciate it.